Bismillah ar-Rahman ar-Rahim. We have a patient who has ischemia. He is diabetic, he has vasculopathy, blood vessels supplying the organ is not giving enough blood supply, and that's called ischemia. Ischemia is when there is decrease in blood supply to a particular area in the body due to thrombosis, due to vascular disease, due to constriction of blood vessels. This area will get into ischemia. And here we see the molecular changes and what's happening in the cellular level with ischemia. Now, ischemia, what does it mean? Decrease in blood supply. And what's the function of the blood? Blood is full of oxygen. Why we need oxygen in tissue? Because oxygen will burn glucose, will burn the fuel of the tissue to give energy, okay? Giving energy by oxidative phosphorylation. The oxygen work in the mitochondria for aerobic metabolism of glucose, which is aerobic glycolysis. Here it's anaerobic, but in normal status we have oxygen that goes to cells, helps glycolysis to continue and Krebs cycle to happen in the mitochondria, and that will generate a lot of ATP. Adenosine triphosphate is the energy molecule. It is not produced in large amount if there is ischemia. So the first thing that happens in ischemia is that there is decrease in energy molecule. There is decrease of energy. Why do you think we need energy in cells? Why we need energy? The cells has internal environment that is different from external environment. One of this thing is that the sodium inside the cell is much less than the sodium outside the cell. You know that sodium follow water. If there is decreased sodium inside the cell, that means water will not fill the cell a lot. There will be limited amount of water that going inside the cell because there is less sodium inside the cell. What keep the sodium low, normal status, and inside the cell compared to the outside is what's called the sodium-potassium ATPase. This channel help getting potassium inside the cell and excreting or getting sodium outside the cell. So one of the first things that happen if there's decreased energy is that this sodium potassium ATP, the channel will stop working, and that will cause accumulation of sodium and efflux of sodium, and water will follow to the inside of the cell. Now think of the cell that is getting and receiving more sodium and more water. This cell will enlarge and there will be swelling inside the cell. The cell will swell until rupture. The beginning will be reversible. It will be returned normal if ischemia is resolved. But if ischemia continue, and the cell will continue to enlarge, and that will cause rupture of the cell. At the beginning, when the cells start to enlarge, of course, also organs or organelles, I should say, organelles inside the cell also start to swell. Endoplasmic reticulum swell, and the cellular swelling, and there will be loss of microvilli. The endoplasmic reticulum is attached by ribosomes. Ribosomes make proteins. Ribosomes is the machinery, is the factory for protein production. So when the endoplasmic reticulum start to swell and the ribosomes are attached normally to this endoplasmic reticulum, now there will be detachment of ribosomes. When there is detachment of the ribosomes is no longer attached to endoplasmic reticulum, and that will result in decrease in protein synthesis. Why there is decrease in protein synthesis? Because the ribosomes will not work in the right way. Okay, so try to follow the sequences. We have decreased oxygen coming to the cell, decreased oxidative phosphorylation and Krebs cycle and aerobic glycolysis, decreased energy production, and energy will result in decrease in the function of sodium potassium ATPase. The sodium will come inside the cell, and the calcium and water. The cell will swell, endoplasmic reticulum will swell, detachment of ribosomes because of that, and decrease in protein synthesis. And of course, we know that proteins make a lot of cellular reactions. Enzymes are protein, channels are proteins, hormones are proteins, everything. Proteins is the functional activities of the cell. Another thing that we see also here is that the anaerobic glycolysis, as there is no oxygen because of ischemia, the glycolysis will be staying only and consuming only glucose in anaerobic pathway. Okay, this will give some energy to keep the cell alive for only temporal time. That which should not continue. If that continue, the low ATP will result in death of the cell. But you see the increase in the anaerobic glycolysis. What will happen? There will be increase in lactic acid. The lactic acid is an acid that is the end result of anaerobic glycolysis, and because it is an acid, there will be increased acidity inside the cell, and acidity is measured by the pH, so the decrease in pH increase the acidity inside the cell. That is another harm of ischemia. Increased acidity inside the cell will change the environment. The cell is full of biochemical reactions, full of enzymes that need to be activated, that work in different chemical reactions. So if there is increased acidity inside the cell, these enzymes will stop to work, and that will result in cellular dysfunction. We know if there is cellular dysfunctions, the tissue will start to dysfunction, and also the organs, and there will be dysfunction or disease that develop. So this illustration is the figure, the diagram is simple, but it helps us to know what happened in disease, what happened in ischemia. You know, ischemia, there might be myocardial infarction, ischemia happening in the heart, ischemia may happen in small intestine, I should say the large intestine more, in splenic flexure. Ischemia may happen in distal vessels, in big toe, for example, in a patient with diabetes or vascular disease. So ischemia is a bigger term that describes kind of pathology, kind of cause of cellular injury, and all this happens that lead to dysfunction and disease development.